From now on, your doctors can only prescribe generic medicines to you, or they will be penalized, or worse, could lose their license. This is one of several guidelines issued by the National Medical Commission or NMC and has quickly become a hot topic for debate. Why? The NMC defines generic medicines as products that are comparable to brands or reference listed products in dosage form, strength, route of administration, quality and performance characteristics, and intended use. Simply put, they are affordable versions of branded drugs. For instance, paracetamol is the generic name of the drug used in case of pain or fever, while Crocin or Calpol are the branded versions of the drug. Generic drugs are 30 to 80% cheaper than branded versions and therefore help save a significant chunk of patients' money spent on medical bills. So shouldn't the move be a win-win? Not exactly. According to the Indian Medical Association, less than 0.1% of the drugs manufactured in India are tested for quality. According to the IMA, this move transfers the authority of making medical decisions from a registered medical practitioner, a doctor, to a chemist who might promote only brands with good profit margins. But wait, isn't that something many doctors are also accused of? Prescribing expensive drugs. According to a survey by Cipla, one of the leading Indian pharmaceutical companies, only 17 out of 100 pharmacists in India hold medical field degrees. To avoid any confusion in prescriptions, the NMC states that prescriptions should be legible and preferably written in all caps to avoid misinterpretation. In fact, it has provided a template for writing prescriptions rationally. Coming to the big question, are generic medicines safe to use? According to the Economic Survey, India is the largest provider of generic medicines, producing 20% of the world's supply. Studies by PGI-Chandigarh have indicated that generic drugs are effective even for organ transplants, and the National Drug Survey has identified around 95% of generic drugs as being safe. India's $50 billion drug manufacturing industry exports medicines to over 200 nations and makes 60% of all vaccines. However, the recent instances of Indian generic cough syrups causing the deaths of dozens of children in several African nations have raised questions about the authorities approving these drugs. After all, generic medicines must also obtain Food and Drug Administration approval for prescription and consumption. For more such news, views and insights, follow and subscribe to Business Standard.